He is a trauma surgeon at Johns Hopkins, and we're so lucky to have him here with us today.
Well, good afternoon. It is great to be back in the city of Seattle, and it's great to be here with all of you, such a diverse and interesting group of individuals that are here committed to probably one of the most important problems that we face here in America. And I want to just take a second to thank Renee and the rest of her team, as well as the Alliance for Gun Responsibility, not just for the invitation to be here, but for the tremendous work that they have done over the years to ensure that we are working at the local and state level to pass common sense gun reform. It's tremendous. Thank you very much. And what some people might not realize is the fact that in America, most governing happens in our own backyard at the city and state levels. So yes, while we want to see change happen at a federal level, each and every one of us, we have an opportunity. We have an opportunity to work within the fabric of our own community to actually move this needle forward. And, I can't really begin talking to you about this issue without telling you my own story and why I'm even here. Yes, I'm a trauma surgeon, and yes, I take care of these patients day in and day out. But, I was born just a stone's throw away from our nation's capital in Fairfax, Virginia. And I was born to immigrant parents that came to this country in search of those hopes and dreams that so many of us strive for. And I went from a healthy 17-year-old high school senior to someone that was nearly killed after being shot in the throat with a .38 caliber bullet. Now, I don't know how many of you were at the age of 17, and I see some young people in the room, but I think most 17-year-olds, they don't realize the fact that they're mortal. They don't realize the fact that there are people that love them. They don't understand or know what they want to do for the rest of their lives. And shortly after my injury, I was standing in the bathroom looking at myself in the mirror. I had a tracheostomy tube. I had these beet red scars up and down my neck. And what I didn't know was my father was standing at the doorway. And he came in and he saw the look in my eyes and how devastated I was. And he said, "Listen, Joe," he said, "what happened to you was terrible. But you have two options. Number one, you can feel sorry for yourself. Or number two, you can take this second chance and try to impact the lives of others." And that was a real defining moment in my life. It's what inspired me to go into medicine. It's what inspired me to become a trauma surgeon. And it's what really drove me to think, how do we work beyond the operating room, beyond the trauma center, beyond our institutes, so we can really function at that intersection of medicine, public health, and public policy. Make no mistake about it, this is a public health crisis that we are facing. People talk about the 40,000 deaths that we have a year, but for every one of those deaths, there are probably anywhere from 2 to 3 non-fatal injuries. And we still currently do not understand what the scope of that problem is. And that's important because we know that the recidivism rate can be as high as 55% in cities across America. We have people like Dr. Ashley Hank and the president of the American College of Surgeons, Ron Mayer, that are here with us that are working on these issues here within your own city at Harborview. The other piece that I think is so important to mention is the media highlights a lot of these mass shootings. And yes, it is important for us to stop these mass shootings. But I think it's also important to recognize that these mass shootings are less than 2% of the epidemic we face in this country. And there are young black men that are being killed on our streets in cities like Baltimore, Philadelphia, Chicago, and their story often goes untold. So we have a responsibility to tell that story. You know, when people were dying from motor vehicle fatalities in the 60s and 70s, we didn't get rid of cars. No, we came up with seatbelts and airbags, and we figured how to make roads safer, right? That's how we have to approach this problem. The reality is focusing on human behavior is not cost effective. We have to develop a system that will make it less likely for people to be injured. You know, the medical community over the past year has really found its voice. And I think one of the reasons after the NRA's comments in November that we resonated with so many people is because of the first time the American public was able to see what those of us on the front lines of healthcare are dealing with on a daily basis. You know, I'll just leave you with this last story. I recently had a 17-year-old kid that was shot in the back of the head. And I had to go up to the ICU to talk to his mother. And it was a non-survivable injury. And I was explaining to his mother that there's nothing that we could medically do to bring him back. And as I was telling her about this young man, she said, you know, she said, he was the first person in our family to graduate from high school, right? That's a big deal in the African-American community in Baltimore. He had aspirations of going to college. Now, those dreams will never go fulfilled. And as she looked up at us, she saw our face and she said, walked over and she put her hand on my shoulder. And she said to me, she said, "Are you okay?" Now, imagine this for a second. Here is a mother that just lost her son and is asking us, the healthcare professionals, are we okay? It's moments like that that restore my faith in humanity. And it's moments like that which I think symbolize the importance of each of us working day in and day out. We have both the possibility and the responsibility to reduce farm-related injury and death in America. Now, your story doesn't have to be as dramatic as being shot in the throat, or maybe it's more dramatic. Maybe it's a story of a father like Fred Guttenberg, who one day woke up not realizing that his 14-year-old daughter, Jamie, is never coming home again. You know, Fred and I should have never been friends, but we are. And we've worked quite a bit together over the past year to try to continue to push common sense legislation. You know, Jamie wanted to be a physical therapist. And I always wonder, I was telling Fred this morning, how come I survived and how come she didn't? It's philosophical, but not everyone survives. Not everyone is lucky to have that second chance. Fred has been one of the strongest voices in America on this issue. So I would really ask all of you to please help me welcome Fred Guttenberg.